Good day, class. In this video, we are going to start a new topic on the diagnostic method of Chinese medicine and acupuncture, listening and smelling. These two diagnostic methods are similar to the inspection and inquiry. These are very common use diagnostic methods in our daily practice. That's how we gather the information from our patient in our clinical practice. The four diagnostic methods in some books or some articles, you will always see that we always combine the four diagnostic methods in Chinese medicine and acupuncture in order to gather the clinical information. But when you see from here, we have introduced 5 diagnostic methods actually: inspection, listening and smelling, inquiry and palpation. But why they said 4 diagnostic methods? The reason is because the 4 diagnostic methods is a direct translation from Mandarin. 望、闻、问、切. So these 4 diagnostic methods represent inspection, listening and smelling, inquiry, palpation. The reason is from the 闻. 闻 in Mandarin refers to both listening and inquiry. Previously, when we introduced the history of Chinese medicine, we have mentioned that from the character, the way we write the character, you can see the meaning of the word. So this one, this character, it consists 2 parts. The first one, when we make it bigger, you can see more clearly. This sign is the door, so this is very similar to the traditional door. You open from the middle, so that's the door. The one in the middle, this one is the ear. So this character means you put your ear on the door. So that's listening. You try to listen what happens in the house. And this character also refers to smelling. Similarly, 问, the inquiry, the way to write the inquiry also very similar. Also the sign of the door, and then in the middle is a mouth. So that's very similar to a mouth. You put in the middle, you put your mouth on the door, which means you are asking something in the room. That's inquiry. So that's why we have introduced 5 diagnostic methods, but sometimes you will see there are 4 diagnostic methods. In this session, listening, we actually focus on different sounds from our human body. The sounds, especially such as the voice, speech, this can reflect the 脏腑 organs. That's because in order to have a normal speech or normal voice, we need the 脏腑 organs function. We need them to perform well. For instance, if someone got the speech disorder, so that might be, if they can't explain or if they can't express them well, it might be the mental problem. The mental problem that's related to the spirit, so we call that the heart problem. That's how to analyze from our basic theories which we have introduced in the first semester. When we talk about the voice, we also will think about how we can have our voice, or what organs, what tissue is going to affect, such as the mouth, the breathing, your tongue's function, and the tongue is the orifice of the tongue is the orifice of the heart, and the breathing is related to the lung and also the throat. So these are different organs or different tissues that are related to the voice, especially in Chinese medicine theories. We more focus on the heart, the lung, and the kidney function in the voice. In order to listen or to identify well, we need to have a quiet consultation room. Similar to the other section of the study, in order to identify the pathological condition of the different symptoms and signs from clinics, we need to understand what's the normal condition. So the normal voice, a healthy person do not emit, so there's no sounds except soft breathing. Sometimes you can hear, and in general, men have low, deep voice. Women have high, clear voices. Children have sharp, clear voices, and the elders also have deep voices. So these are different normal voices according to different age or different group of people. That's the normal variation. The abnormal voice refers to the changes in the voice and tones, such as hoarseness or loss of voice. The abnormal voice can reflect the healthy qi, which is the antipathogenic qi, or the pathogenic factors, such as a loud just in the voice and in the tone. A loud, continuous voice often indicates excess syndrome or heat syndrome. A feeble, low, intermittent voice coupled with shortness of breath and reluctance to talk often indicates deficiency syndrome and cold condition. Similar to the other sessions study, from the diagnostic, you need to understand what's the signs, what's the manifestations, and also you need to know what's the cause. So that's the clinical indications. That's something you need to remember. How to remember this? This is why a loud, sonorous, and continuous voice indicates excess syndrome, and a feeble, low, intermittent voice coupled with shortness of breath indicates deficiency syndrome. So from here, how to remember this or how to identify when from a multiple choice. A loud, sonorous, continuous voice often indicates, then that's the brackets there. You're going to choose from different answers. How to remember this is you need to understand that's the excess syndrome and the deficiency syndrome. So why they fail in these two different why they fall in these two different categories? That's because from yin-yang theories, excess is yang, deficiency is yin. But when you compare with a loud and feeble, or low, continuous and intermittent, it's also in different categories of yang and yin. So the yang symptoms falls in the yang category. That's the yang category. A heat, also yang. So that's why excess syndrome. A feeble, low, intermittent voice, shortness of the breath, reluctance to talk. That's yin syndrome. So that's why it falls in the yin category or cold syndrome. That's also yin. So that's how to understand the clinical manifestations through the theory. And in the abnormal voices, we mostly will think about the lung directly. That's because the breathing is related to the voice directly. So the next one, hoarse sound or loss of voice. Acute hoarse sound or loss of voice since in excess syndrome. when we compare with acute and chronic, acute also young. Acute, when we said acute, it mostly refers to the onset is very quick, or the period, the course of a disease is short. So mostly caused by the external contraction of the wind is the external pathogens. It can be others. The chronic hoarse sounds and loss of voice. And loss of the voice is seen in deficiency syndrome. So that's the in condition. In deficiency. It can be the lung deficiency or the kidney deficiency. Here, when we mention the kidney, why the loss of the voice can be the kidney problem. That's the theories. That's when we talk in the basic theory. What's the function of the kidney? That one function of the kidney is to receive qi. So the lung can help to breathe, but in order to get deep breath, that's the function from the kidney. That's why if the patient have shallow or short of breath, it can be the problem from the lung. It also can be the problem from the kidney. A sudden hoarse sound in chronic condition or critical condition indicates erosion of lung qi. If you see a patient with persistent or hoarse sound and gradual aggravation, the patient, the voice was normal before, but now gradually the patient developed into a hoarse sound and then also accompanied with the other symptoms such as losing weight. You need to think about cancer. So in this condition, you need to send the patient to have the blood test. Women in the last trimester of the pregnancy may develop hoarseness or losses of voice. This is because the growing of the fetus compressing the kidney, and the kidney cells are failing to nourish the throat and the tongue. In this condition, sometimes we don't treat them. The reason is this condition may resolve spontaneously after the childbirth. But for this condition, we need to identify its abnormal or physiological condition. So when a patient presents or a pregnancy lady presents with the losses of voice, you need to combine with the other diagnostic method to find the proof to support your conclusion. Groan. This refers to a deep, inarticulate sound due to discomfort. This sound of voice is not a specific voice, but you can see the patient they don't feel comfortable. That's the noise coming from there. So such as the patient feel sometimes you can hear this kind of sounds that's so this kind of sound or noise can indicate that the patient is in a discomfort condition. We often associate it with the pain or kidney deficiency. Screaming is a sudden outcry of patients, and this refers to the loud noise or a loud sound. Weird screaming noise can happen in like epilepsy seizures. The screaming, the patient also can have like pain, severe pain, or fear so when you hear someone screaming, then you will know something happens to the person or the patient. The above is a very brief introduction of an abnormal sound or voice. As you can see from the causes, it can be exogenous pathogens. It also can be endogenous pathogens. So you can see a lot more information in your textbook under this category. It can be exogenous factors such as the wind cold, wind heat, or the endogenous pathogens such as the phlegm and dampness. When they affect the lung, it can cause abnormal sounds. So it can be deficiency pattern. It also can be excess patterns. So how do we understand or how do we memorize? Can we see anything from nature that have a similar phenomenon? That's from the saying, the muffled metal fading to sounds and broken metal fading to sounds. These two old sayings indicate that's what happens to the abnormal voice or sound for our human body. The muffled metal. The metal refers to the bell, as you can see from the image on the right bottom. That's very traditional bells, and nowadays we still can see in temples. In temples, they still use this kind of belt, and from a good belt, from a very good bell, we can hear a loud and clear sound from the bell. As you can see from this short video, a monk was hitting a bell, and you can hear a loud and clear sound from the bell. The reason is because this bell is good, and also as you can see from the bottom, now the image there, you can see from the bottom of the bell, it's empty inside. So the muffled metal, you just imagine that if you feel something from the bottom to the bell, you feel up something in the belt, then the belt becomes solid. When you hit the bell, you won't hear that clear and loud sounds. So that's become abnormal sounds. But what's the cause? There's something fill up the bell. There's a muffled bell or muffled metal. And then you imagine again a broken metal. The same bell, the same person hits the bell, but the bell is broken. So from a broken belt, from a broken bell, you also don't hear that clear and loud sound. And now we go back to our human body. The metal in the 5 elements, not the lung. So muffled metal fading to sounds, which similar we can think about muffled sound, muffled lung. What does I mean by muffled lung? So the lung is very similar to the bell. It needs to be empty inside. If something fill the lung, what can fill the lung? Such as the phlegm and the dampness can fill the lung. That's a muffled metal fading to sound. So if there's phlegm and dampness in the lung, fill the lung, then we will have abnormal sounds such as cough, such as hoarse sounds. So that's from the excess pattern. A broken metal fading to sounds. That means the deficiency, because broken is deficiency. You lack of something. That's deficiency. So this is very similar to deficiency. Lung deficiency also will cause abnormal sounds. So from this session, especially from the abnormal sounds and voices, mostly you need to remember these two: muffled metal fading to sound and broken metal fading to sound. So one is excess, one is deficiency. Muffled metal is the excess, refers to the excess pattern of the lung. Broken metal refers to the deficiency pattern of the lung. On the abnormal sounds, they also have like signs or sneezing. So those we are going to talk in the later slides. The next one we're going to introduce here is the speech and language. A healthy person, a healthy adult, supposed to be able to express themselves clearly, and the speech should make sense. So the listening to the speech and language can reflect the mental function of the person. The mental function of the person in acupuncture theories is related to the heart function. So we can listen the speech and the language, and then we can see the heart function, especially the heart mind and the heart spirit. So the first one, delirious speech. This refers to a disturbance in unconsciousness, a language disorder, or talkativeness in a high-pitched voice, and restlessness. Be careful here in the textbook says consciousness. That's the wrong word. It should be unconsciousness. Delirious speech, also unconsciousness. From the description of the delirious speech, you will see that this is a yang pattern, an excess pattern. The reason is because the talkativeness, high-pitched voice, that's all yang symptoms in yang category, and restlessness, also very active. So these are all yang, so excess pattern. When you compare with the fading murmuring, refers to unconsciousness with a repeating incoherent murmuring in a low voice. So when you compare with these two, you will understand one is yang, this one is yang pattern, this one is yin pattern. And the delirious speech refers to a yang excess pattern. The fading murmuring refers to a deficiency pattern. So this can happen, and these two of all happens in unconsciousness, which means the language, the speech doesn't make sense. So this mostly happens in severe condition of the patient. Disorganized speech refers to a frequently using the wrong words or the wrong expressions with realization of these mistakes after they have been made. So in this description, you will see that the person will use the wrong words or the wrong expression, but afterwards they will realize that they have used the wrong words, wrong expressions. This can reflect the heart condition as well. Why they will have the wrong words? That's because the heart spirit fail to be nourished. So the heart mind, the qi and blood, failing to nourish the heart mind. Or the kidney essence failing to nourish the brain marrow. So brain marrow also part of the function of the heart mind. And mostly this can happen in a patient after a long-term disease or a very senior people. So in senior people, sometimes you can see the disorganized speech. Muttering to oneself refers to talking to oneself while other people are not around. is often seen in psychological problems, depression. So this person will talk to themselves if there's no one else there, and they will stop if someone else is there. So as you can see from here, this is a mental problem. Contributing factors can be also anything related to the heart mind. Flame fire, the heart mind. So if you relate to the heart mind, ravings, this includes insanity, incoherent speech, irrational talking, and unable to recognize family members. As you can see from the description, that ravings also refers to a mental problem. The patient is not able to recognize the family members, and the description what the activities the patient may perform is climbing up to high places to sing, and walking without clothes. So you can see in our daily life who walk naked in the street on the street. So that's something have a mental problem. Or someone you can see if you see someone climb to the roof and sing on the roof. So that might be the mental problem. That's also related to the emotional the and this emotional can affect the heart and mind. So and these causes that affect the heart mind will result in ravings. When we talk about ravings, you can think about the muttering to oneself. These also pairs. One is yin pattern, the other one is yang pattern. So the ravings is a yang pattern. Why the person will climb up to high places to sing, why they don't stay in the house. That's because the yang symptoms, the yang category, or the characteristics of a yang symptom, they will go outside. That's why they walk on the street without clothes. That's why they will go to a higher place, because a higher place is also a yang place compared with a low area. So climb up to high places to sing. In the case, ravies is a kind of yang pattern. And then muttering to oneself is an yin pattern. Slurred speech. Slurred speech refers to a poor or difficult pronunciation of words in people with clear mental consciousness. So from here you can see this condition, the patient is in consciousness condition. The mind is clear, especially when they happen with hemiplegia or deviation of the mouth and eyes. It can be a sign of stroke or a sign of a result of a stroke. On this session, it is very important to understand what's a normal speech, what's a normal voice and speech, and abnormal voice and speech. Especially, we need to understand what does it mean by muffled metal fading to sounds and broken metal fading to sounds. On the speech session, we need to be able to identify an excess pattern and deficiency pattern from the different definitions of the speech, abnormal speech and language. In the next video, we're going to talk about the listening from the breathing, the abnormal breathing, and also other abnormal sounds from the body. Thank you for your attention.